Hello, my name is Stuart Howard. I am a nurse practitioner student here at Youngstown State, and this is, what's your name?
Melissa Howard,
And how old are you?
21 years old.
All right, very good. Today, we're actually going to do a neurologic exam and also a musculoskeletal assessment. So we're actually going to start with the cranial nerves. So we're going to start with the first cranial nerve, which is the olfactory. So if you could actually close your eyes and close one of your nostrils.
Tea tree.
Very good. And then close your eyes again and close the other nostril.
Peppermint.
Very good. And she got both of those correct. We're going to go to the second one, the second optical nerve, which is the concentration of her visual fields. So we are going to, if you could cover one eye with one hand. Very good. And then I'm going to cover this. And then, what number do I have out? Look.
1, 2, 3.
All right, switch hands. And I'll do that.
1, 2, 3.
Very good, very good. All right, so right now we would do a visual, the Snellen chart. If you could actually just walk that way for me. Very good. And then, do you have contacts on?
I do.
All right, so my Snellen chart's over there on the wall. And can you cover one eye and just read the smallest line you can read?
C, F, D, H, G.
Very good. Can you cover your other eye and do that one, please?
C, F, D, H, G.
And with both eyes, read the smallest line you can read.
C, F, D, H, G.
Very good. Come over here and have a seat for me. All right, she does have contacts on. So we are going to do the nerve number 3, nerve number 4, and nerve number 6. So that's going to be the ocular, the trochlear, and the abductans, okay? So we're also going to do the perla right now. So if you will actually just look at my nose, and then I'm going to bring my light in from this side, very good. And then we're going to do it again from this side, very good. And if you could look out that way, and I'm going to bring this in, very good. I'm going to go to your 6 fields of vision, so if you could follow the pen with your eyes. Very good. So her eyes are, her pupils are equal, round, reactive to light, and accommodation. We went through 6 fields of vision. Those were actually good, and she did not have any nystagmus, and her eyes did react to the light. So we're going to go on to nerve number 5, which is the trigeminal. And that is, I'm going to find your jaw. Open your jaw for me. Very good. I want you to close very tight. Very good. I want you to open your mouth. Very good. I want you to take your jaw and move it to the left. Move it to the right. Move it up. Move it down. Very good. All right, so we are going to do the sensory function of those muscles, or those of those nerves, and we are going to do that by taking a cotton tip, and typically I would put it on her eye, but she has on contacts, and I don't want her to lose her contacts, but that's how we would actually do that. So we're going to move on to facial nerve number 7. And then I want you to close your eyes real tight for me. Open them wide. I want you to smile for me. I want you to frown for me. Very good. And I want you to puff out your cheeks for me. We're going to do the whisper test right now, which is nerve number 8, which is the acoustic. So if you could cover one ear.
Baseball.
Very good. Cover your other ear.
Chicken nuggets.
Very good. All right, so that is the whisper test. So right now we're going to do the Renee test. So you tell me which one you hear the loudest, okay?
First one.
All right, very good. And then the Weber test, you tell me if you hear on the left, I'm sorry, on your right, on your left, or in the middle, okay?
Center.
Very good. So we are going to move on to nerve number 9, which is the glossopharyngeal nerve. I want you to say ah. Very good. One more time, say ah. Very good. Her uvula did actually move up. So, and then here we would actually test the gag reflex. I'm not actually going to gag her right now. But that's where we would actually check for the gag reflex. So nerve number 10, which is the vagus nerve. We want to make sure that they're talking without any hoarseness. So how are you today?
I'm doing great.
Very good. Can you swallow for me? Very good. So we're going to go to nerve number 11, which is the spinal accessory nerves. So I want you to move your head from left to right, up and down. All right, move again to the left, and then move to your right. Very good. Can you shrug your shoulders for me? Very good. And then nerve number 12, which is the hypoglossal. And then I want you to stick your tongue out at me. Stick your tongue that way. Stick your tongue this way. Up and down. Very good. I want you to puff out your cheeks. Very good. And I want you, with your cheeks puffed out, I want you to stick your tongue out in your cheeks. Very good. All right, so for the cerebellar function, we're going to do rapid movements on your legs. So put your hands down, left, right, left, right. Very good. I want you to touch your nose. I want you, with your finger, touch your nose, touch my finger. Touch your nose, touch my finger. Touch your nose, touch my finger. Very good. So we observed the patient's gait when she actually walked over there to do the Snellen test. And her gait was really good. There's no ataxia. There's no staggering or anything like that. Can you walk that way, heel to toe for me? Very good. And then if you could come back this way. And then just have a seat there. All right, so we're going to do the heel to shin test. So if you could take your heel and put it on your shin from your knee and put it down and then back up again. And then do the other side, please. All right, that's very good. So we're going to do the proprioception. If you could stand up for me. And then typically we would actually have her stand up for 30 seconds, just like she is now. Then we'd ask her to cross her hands over her chest and then close your eyes. And then we would just hold our hands and make sure that she doesn't actually sway. We would stand here for 30 seconds. All right, you can open your eyes again. We're going to do the sensory function. So if you could actually sit back down there. You let me know if you feel a sharp or a soft. Okay?
Mm-hmm. Sharp. Sharp. Soft. 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 Sharp. Sharp.
Very good. And then we are going to go with the stereogenesis, the ability for her to identify an object. So if you could just open your hand and then you let me know what I put in this hand.
Paperclip.
Very good. And then you let me know what I put in that hand.
Pen.
Very good. So I want you to tell me if I'm touching you in one spot or two spots, okay?
Mm-hmm. Double. Single. Single. Double. Double. Single. Single. Double.
All right, very good. All right, so we're going to test the testing for graphesthesia. So I'm going to ask her. You can open your eyes. I'm gonna draw a number or a letter in her hand. She's going to tell me what that actually is.
A. B.
Very good. so we are actually going to do some of her reflexes. We are going to start with the bicep reflex. And that actually is good. We're going to do the tricep reflex. Relax. And that one's actually working. We're going to do the patellar. You have to sit back, please. The patellar reflex. All right, that one's actually working. We're going to do the Achilles, which is the S1. We'll do this side. That's very good. And we're going to do the biceps on this side. And then we're going to do the triceps on this side. That one's actually working. And then the brachioradialis. So just put your hand out there. Then we'll do this side. All right, and then we're going to do the ankle clonus, which is just relax. And then we do the same thing with this foot. And those actually worked. And then we'll do the Babinski side. If you could sit back just a little bit. All right, so she has a negative Babinski sign on both of those. We're actually going to move into the musculoskeletal. So with that assessment, we're actually going to start with her hands and her wrists. Come back over here. So with the inspection, we're actually looking for some nodules, masses, gross deformities, redness. We're going to palpate the distal joints for any tenderness, any lumps. And then we're going to palpate the radial head. There's nothing going on there. We're going to do the range of motion, which is the extension. So if you can move your fingers up, down, move it to the left, back in. Very good. Move your fingers out and back in together. Very good. We're actually going to palpate the snuff box right here. There's no pain there. There's no pain there. Very good. And then we're going to test for the carpal syndrome, or the carpal tunnel. And I would hyperextend this, and I would tap this and ask her if she had any pain or any tingling in her fingers. And do you? No, we'll do the same thing with this one. We will tap. There's no pain there, no tingling. Very good. All right, so we're going to move on to the elbow. And with the elbow, we are going to start with inspection of the deformity, swelling, redness, tenderness. So I'm going to palpate the Omicron process, which is the tip of the elbow, the medial, which is this one, and the lateral condyle. Turn your hand back over this way. Very good. Make that easier for me to find. And then the same thing with this one. We'll do the Omicron, or the olecranon process. And then on the sides there, and then we're going to do the range of motion, which is the flexion, and then put them back down again, and then turn your hand over this way, and then turn your hand back over. Very good. And then we are going to palpate the shoulders. So again, we would start with the inspection, looking for any redness, any deformities, especially if one shoulder is further down than the other one. So there's no tenderness. We start with the suprasternal knots, and then we move out her
again.
Her clavicle. We move out her clavicle, and we move all the way out to her omicron process, the omicron clavicular joint, and to the croticoid process, which is sort of in the back there. It's actually part of the clavicle. And then we're going to do the range of motion for the shoulders. So can you shrug your shoulders for me again? Very good. Can you raise your hands, both of them? Both of them. And then bring your arms kind of behind you. Very good. And then move them away from your body. And then back down again. And then towards in front of you like this. And then in front of you like that again. And then I want you to scratch your neck, the back of your neck. And then do it again with your other hand. And then I want you to take your hand and reach towards your other clavicle. And then reach toward the other clavicle with your other arm. Very good. And then we're actually going to look at her cervical spine. So can you stand up for me? Can you turn around? Very good. With her spine, we are looking to make sure that, again, we would inspect, looking for any warmth, deformities, tenderness. We would turn this way. I just want to make sure that, you know, her trachea is actually there in the center, in which it actually is. Turn around for me again. Can you tuck your chest, your chin? Look up. Look to the right. Look to the left. All right. Can you put your ear on your shoulder? And your ear on this shoulder? Very good. So make sure we're looking at her spine. We're making sure that her cervical spine is slightly concave, which it is, and then it's convex. It actually comes back out, and then it's a nice lordosis, which it actually goes back in, which it actually is. So we inspect all the rest of her back for any deformities, any redness, signs of infection, and then starting from C7, which is this notch right here, we walk our fingers down, make sure none of her vertebrae are pressed or none of them are sticking out. And then we're going to do the range of motion. So if you could bend forward for me, and then we're making sure that she doesn't have any curvature or anything that's going on with her spine, and which she actually does not. And then we walk down, make sure that none of her vertebrae are sticking out and nothing is painful. So if you could stand back up, lean to your left, to your right. Very good. Look up to the ceiling, kind of bend back. Very good. Bend over one more time for me. So here's where we actually look at her hips to make sure that her hips are not out of alignment. If you could actually just lay down on the bed there, we will actually do the range of motion for her hips. So with her hips, can you lift your leg up? Lift it down. Lift this one up. Lift it down. Reach this towards your chest. And then back down again. Same thing with that. Up. Back down again. Very good. If you could roll over on your side and kick this leg forward. And then kick it back towards me. And then same thing with this one, which means you got to roll back over for me. Very good. Kick this one forward and then back towards you again. Very good. And then with the flip back on your back. So with this, we would actually look at her hips. So we would start with the anterior surface. We would find the iliac spine. I'd have you roll over to your side. This is the greater trochanter on this side over here, and the ischial tuberosities, and then flip over on your back. On your stomach. Getting your exercise in. And then this would be the SI joint, and this would be the base of the spine, which is superior to the buttocks. So if you come over here and sit on the edge over here. Sit on the edge. We're actually going to do your knee. So we would palpate your knee. We would look at the both sides, the tibia and the fibula. The tibio tuberosity We look at the patella. We would look at the tibial tuberosity, the lateral meniscus, the medial meniscus of the knee, and then we would do the same thing over here on this side, looking at both of those, and then we would do the range of motion, which is if you can kick your leg forward and then back again, the same thing with this leg, and then kick your leg that way and then back this way, and then the same thing with this leg, kick it that way and then that way. Very good. So we are going to look at the ankle or the foot, and then again we would do the inspection. Keep going back. We would do the inspection. Any redness, swelling, bruises, infection, inflammation, especially around the toes. We would just inspect all of this. We would start and palpate the, oh yeah, looking at the wrong one. The lateral malleolus, which is on the outside, and the internal malleolus, which is on the inside, and then the calcaneus, which is actually the heel. And then we would look at all the joints in her toes, and then we do the range of motion, which is a flexion, which is towards the ground, and then back up, inside, which is inversion, and outside, which is inversion, and then we have to her ankles in a circle. So that would be the musculoskeletal system assessment. Do you have any questions?
Nope.
All right. Thank you very much.